Today we're talking about chlamydia and how it specifically affects gay men. Chlamydia is one of the most common sexually transmitted infections. Whether you're sexually active or just looking to stay informed, this video is all about what you need to know. Chlamydia is a bacterial infection caused by Chlamydia trachomatis. It's one of the most common STIs out there, and it's spread through unprotected sexual contact. What makes chlamydia tricky is that it often doesn't have any noticeable symptoms, so you or your partner could have it without even realizing it. That's why getting tested regularly is so important, especially for gay and bisexual men who are at higher risk of certain STIs. Chlamydia can be transmitted through different types of sexual contact, whether it's anal or oral sex. For gay men, it's particularly important to know that chlamydia can also affect not just the penis, but also the rectum and the throat. Anal sex is one of the main ways chlamydia is transmitted, and rectal infections often have no symptoms, making them easy to be overlooked. Oral sex can also spread chlamydia, even though people don't always think about it. If left untreated, chlamydia can cause some serious complications, especially for men. A rectal infection might cause symptoms like discharge, pain, and bleeding. Although it's often silent, the infection spreads and it can lead to proctitis, which is inflammation of the rectum and the lining of the anus, especially if it's LGV, which is an aggressive form of chlamydia. Chlamydia can also infect the urethra, leading to painful urination or discharge. Untreated chlamydia can cause epididymitis, which can lead to pain and swelling of the testicles. Let's talk symptoms, though remember, a lot of guys don't have any, but if symptoms do show up, here's what you're looking out for. Burning when pee, usually discharge from the penis, or pain and discomfort of the rectum, or discharge from the anus. You might also experience throat pain if you contracted chlamydia through oral sex. If you notice any of these signs, it's time to get tested, but even if you don't have these symptoms, regular testing is key. Chlamydia is common among sexually active men, and it's especially prevalent among gay and bisexual men. The infection rate is high in the LGBT community, particularly for rectal infections. That's why getting tested regularly is so important, whether or not you're showing symptoms. Many sexual health clinics offer STI testing, especially tailored for the community needs, making it easier to stay on top of your health. Getting tested for chlamydia is simple, and it should be part of your routine healthcare. For gay men, the test might involve more than just a urine sample. If you've had anal sex, your doctor may take a rectal swab to check for infection there, and if you've had oral sex, they may also do a throat swab. It's important to let your healthcare provider know what types of sex you're having so they can test all the right areas. Don't worry, it's quick, easy, and painless. Chlamydia is treatable with antibiotics. If you test positive, your doctor will prescribe a course of antibiotics to clear up the infection. It's important to take all of your medication, even if you start feeling better before finishing. You also need to avoid sexual activity for about 7 days after you and your partner or partners have started treatment. And this is to avoid passing the infection back and forth. Remember, your partners need to be treated too, otherwise you'll be playing STI ping pong. Prevention is key, and condoms are a great way to reduce your risk of getting chlamydia. Whether you're having anal or oral sex, using protection can significantly lower your chances of transmission. And it's also really important to communicate openly with partners about STI testing and prevention. If you've been treated for chlamydia, it's a good idea to get retested about 3 months to make sure the infection is gone and you haven't been reinfected. Regular STI testing is a crucial part of taking care of your sexual health. If you're a sexually active gay or bisexual man, it's recommended to get tested for chlamydia and other STIs every 3 to 6 months, especially if you have multiple partners or you're in an open relationship. Many clinics offer confidential testing tailored to the LGBT community folks, and it's nothing to be ashamed of. Getting tested shows you care about your health and your partner's health. Chlamydia is common, but it's preventable and treatable. Regular testing, using protection, and open communication with your partners are all key to staying healthy.